based on physical training with non-invasive ventilation, positive airway pressure. Doing that, we increase the cardiac function. We put this heart in an optimal mechanical point, and we increase the ejection fraction. But we did not spend 6 months to get these benefits. We get the same benefits, but in only 6 weeks of training. To conclude, I want to say that positive airway pressure optimizes cardiac performance during physical activity, and maybe it can accelerate the cardiac rehabilitation benefits, and also it can bring comfort during the patient treatment.
Actual cause of atherosclerosis is unknown, and if one looks at this, we still lack a unifying hypothesis that explains all aspects of vascular disease. But I think if one looks at the classical risk factors, obesity, dyslipidemia, hypertension, all of these share both inflammation and oxidative stress in their earliest phases. And if one can identify individuals at risk and modify this, there is the opportunity to prevent or at least reduce the risk for the development of atherosclerosis. So all of the different risk factors that we have, they share markers of oxidative stress and inflammation to the subsequent development of cardiovascular disease. HDL is a powerful antioxidant. It carries a number of enzymes in its core, such as peroxidase and others, that have powerful antioxidant activity and protect LDL from being oxidized. Now, the classic LDL receptor, which binds native LDL, is tightly regulated. In other words, once intracellular levels are increased, then this is shut off. Unfortunately, if you oxidize or acetylate HDL, it is picked up by the macrophage in a totally unregulated way. And as long as oxidized LDL is in the vicinity, it will be picked up.
What is this preventive lifestyle? Now, this concept of prevention is envisaged by the World Health Organization. In Ayurveda, individualized medicine is well described. The concept of public health has a restricted description in this system. And concept of prevention is applicable to a large population. And therefore, we must know what this prevention means, because we are going to practice preventive cardiology. So prevention, if you want to prevent any disease, we have 4 approaches, 5 methods. I have begun with primary prevention, but there is one more prevention called as primordial prevention. Primordial prevention is any action such that the disease is unlikely to occur ever on this earth again. Now, there are very few examples for this. For example, the human genome experiment. You make changes in the gene itself, and the genetic disease will not occur at all. So in the morning, our Vice Chancellor said that if Ayurveda is influenced by the concept of Prakriti, and if you are able to demonstrate or link the Prakriti to the genes, probably you might be able to prevent cardiac diseases for permanently from this earth. But this may not occur, this may not happen because it is affected and influenced by multiple factors, multiple determinants, which are yet to be investigated and discovered also. So primordial prevention will have limited application in preventive cardiology. So next chance is primary prevention. Primary prevention is any action which you take before the disease occurs in the body. Yes, and there are only 2 methods: health promotion, specific protection.
where the left main, the coronary left artery divides into the front lady and the back circumflex. If the left main is blocked, especially the distal part, number one indication for bypass surgery. Then if the patient after MI continues to have chest pain, you call the post-infarction angina, then left ventricular aneurysms, post-MR, all these needs bypass surgery. So what are the conduits we can use? I mentioned about the arterial graft. Arterial graft is good because the atherosclerosis in these arterial grafts like Lima and Rima, left internal memory and right internal memory, is very little. And if you put good grafts, they can be good for 30, 40 years. We also use radial artery, which is taken from the thing. If the ulnar artery and the arches are okay, you can remove a section of the artery and use it separately or in Y. Inferior-mesenteric gastroeploy cannot use nowadays, but venous grafts are commonly used. So one of the advantages of CABG is that it relieves the angina. It relieves